Hello, I'm Melissa Galloway, a student at American Sentinel School of Nursing and Post University. The topic of this video presentation is Continuum of Care for SIM 440, Collaboration for Improving Outcomes. For this project, we were asked to explain how the concept of continuum of care is used in case management within the organization that I work for, then explain the new services or programs that my organization is currently evaluating or performing that are assisting patients to reach their health goals. The next thing we were asked to look at is explaining how the new services or programs can impact the bottom line of the organization. Choose a quality indicator and discuss how it can influence the quality of care. And lastly, assess the practice of linking hospital reimbursement to performance outcomes. One definition for continuum of care is a concept involving an integrated system of care that guides and tracks patients over time through a comprehensive array of health services spanning all levels of intensity of care. And that's Eva Swick. How continuum of care is used within my organization? Chronic diseases are more prevalent today, lending to increased complexities when treating patients with chronic diseases. Through this treatment process, focus is being directed to coordination of care with all disciplines in the plan to increase outcomes for the patient. One of the critical times for this coordination of care is the transition phase from hospital to home under the care of the primary care physician, and that's from Dureg and group. In this critical time of transition, medication reconciliation and follow-through is critical, as this is one of the top reasons for readmissions to the hospital. Once a client is at home, the management of the disease process continues. The patient then needs the assistance of community resources. The mission from our organization is to improve health, elevate hope, and advance healing for all. Continuum of care in my organization is multi-layered. We have primary care practices, urgent care centers, acute hospitals, skilled nursing facilities, inpatient rehab, home health, and hospice. In the acute hospital, the client has a case manager who assesses the client's needs in a holistic manner. They assess what resources the client will need post-discharge, set up additional resources like home health if needed, ensure the client has the appropriate durable medical equipment ordered, begin the process for applying for additional health coverage if indicated, and make all the post-acute care appointments with their primary care physician and any specialist that's indicated. If it's indicated that the client needs home care, a transition liaison is assigned to the client who will meet personally with the client, explain home care services, and answer any questions the client has, decreasing the vulnerability of the patient. The transition liaison communicates with the home health agency any special requests that the client indicated, such as using the back door to enter the home, or client requests early morning visits. Once the client is admitted to home care, they're assigned a registered nurse case manager if indicated, otherwise a therapist case manager. The case manager in home care oversees the client's plan of care, collaborating with all other disciplines in the plan of care: the physician, pharmacy, durable medical equipment companies, their family, and the patient. The case manager is educating the client on home management of their chief complaint, with the client's goal as the main driver of the plan of care. At the time of discharge, the case manager sets the client up with outpatient services such as obtaining supplies, venipunctures for continued monitoring, and ensures that they will follow up with their primary care provider. Services and programs helping clients reach their goals. One service that my organization is performing that is assisting patients to reach their health goals is providing mass COVID-19 vaccination clinics. The Charlotte Motor Speedway was turned into a vaccination site by opening the bay doors of the garage, and people would drive into the garage on one side, get vaccinated, and drive out the other side. A second site utilized for mass vaccination was the Bank of America Stadium, where the National Football League Carolina Panthers play ball. Atrium Health joined a coalition to administer 1 million COVID-19 vaccines by July 4th, 2021. Another service that my organization is performing that is assisting patients to reach their health goals is providing the patient portal, My Atrium Health. In the portal, you have access to send a message to your provider. You can review physician notes, lab reports, x-ray reports, patient education, request a refill on a prescription, along with other functions such as making payments. Another service that my organization is performing that is assisting patients to reach their health goals is providing medical care to those who do not have insurance through the program Physician Reach Out. It is known that lower socioeconomic areas have less access to care for multiple reasons, and our mission is to provide care to all. Impact on the bottom line of the organization. The impact of the mass vaccination clinics has been quite substantial. When the public vaccination clinics began in January, the cases began to slowly decrease. In the beginning of January, the average new cases per day was about 10,000. Then March, it was down to 2,000. And now, June 26, 2021, there were 0 new cases in North Carolina. And that's according to North Carolina Health News. When taking into consideration that the hospital was full and had to divert clients during the height of the pandemic, the cost of supplies for personal protective equipment, and the increased wages for more staff to take care of more patients, this service had a significant impact on the bottom line. My Atrium Health Portal has an impact on the bottom line as the clients have access to information that they may normally schedule another visit to their physician for or place a call to the physician for. It impacts patient satisfaction as the patients want to know their test results as soon as possible, and when they must wait on that phone call, they get anxious. The Physician Reach Out program assists clients with medical care in a clinic setting, and it aids them from having the inclination to visit the emergency room for non-emergent situations. Avoiding unnecessary ER visits is a significant cost saver to the bottom line. Quality indicator. One quality indicator that affects all aspects of the continuum is safety. In the hospital setting, measures must be taken to prevent falls. Staff must ensure that the bed rails are up as indicated by a client's fall risk. The call light is within reach to allow the client to call for help when needed. Ensure the client has non-skid footwear. Additionally, to reduce fall risk in the hospital, the client must be educated on safety measures. Avoidable falls with injury will have a negative effect on the client's overall outcomes. While the client is at home and on home health, a falls assessment is conducted on the first visit to the home. The client is placed on falls precautions as indicated. The client is instructed on proper use of any assistive devices, instructed to remove rugs and loose cords. The client is instructed on the use of night lights and calling for assistance as indicated. The client is placed in a therapy program as needed. The goal in home care is to teach self-management at home and avoid rehospitalizations. The quality outcomes of home care agency are affected by avoidable hospitalizations due to injuries from falls. Another example of safety that affects outcomes is oxygen therapy safety. Clients must be educated on the safety of oxygen use. In home care, we utilize a video to show the clients the effects of smoking while using oxygen, and it shows a blast fire as a result. Clients are also educated to avoid using products with petroleum. Clients are also instructed on safety in relation to falls and trips over the cording. Hospital reimbursement links to performance outcomes. Medicare hospital value-based purchasing was instituted to incentivize low-performing hospitals by evaluating the scoring of the hospital consumer assessment of healthcare provider and systems measures, which we refer to as HCAHPS, including patient experience scoring. This pay-for-performance model reimburses the institution for what they do and how well they do it. In 2015, the Medicare value-based purchasing model paid out $1.4 billion in performance-based incentives, and that's from Elliott and Group. The value-based purchasing model is not effective in all states. However, in our network, North Carolina was affected by it. This is the end of my report. Thank you.